Hanukkah is a polyphenolic compound from the bark of the magnolia tree. Magnolia bark extracts have been used traditionally as sedatives and to improve sleep and to relieve anxiety, and hanukkah is being investigated for its potential usefulness in treating inflammatory pain. Like other polyphenols, hanukkah has oxidative stress-reducing and anti-inflammatory activities. It appears to cross the blood-brain barrier and to interact with certain neurotransmitter receptors in the brain. Lab research shows hanukkah and some of its derivatives activate certain GABA receptors, and it may also interact with receptors for glutamate, dopamine, and serotonin, and influence acetylcholine signaling. One form of hanukkah has been shown to stimulate cannabinoid receptors, and this might be involved in decreasing pain perception. In one study, treatment with hanukkah reduced pain-related behaviors in mice in experimental models of inflammation. Findings from other studies indicate the hanukkah can also decrease acute inflammatory pain without causing motor or cognitive side effects, and it might prevent and decrease some of the chronic pain-related changes in the brain. Pamethyl ethanolamide, or PEA, is a lipid compound, and it occurs naturally in the tissues throughout the body, including the central nervous system. It can be found in foods such as soy lecithin, egg yolk, and peanuts. A growing body of research suggests PEA supplementation can be effective for relieving pain from a variety of causes without triggering adverse side effects. Most of the existing preclinical research indicates the PEA works by changing the expression of certain genes and reducing inflammatory signaling, but other possible mechanisms for its analgesic effect have also been proposed, including its ability to stimulate signaling through the cannabinoid receptors in the nervous system. Several clinical trials have shown that PEA can reduce pain from a broad array of causes, including diabetic neuropathy, chemotherapy-induced peripheral neuropathy, sciatic nerve compression, carpal tunnel syndrome, osteoarthritis, lower back pain, failed back surgery, stroke-related nerve pain, multiple sclerosis, dental pain, chronic pelvic pain, post-herpetic neuralgia, and vaginal pain. In an observation study of individuals with chronic pain due to a variety of conditions who were unable to control their pain with the usual therapies, adding 600 milligrams of PEA twice a day for 3 weeks, followed by once a day for another 4 weeks, decreased the average pain intensity scores in all participants who completed the study. In a randomized control trial, 636 participants with pain due to compression of the sciatic nerve received either 300 milligrams of PEA daily, 600 milligrams PEA daily, or placebo in conjunction with their usual pain medication for 3 weeks. Both doses of PEA resulted in greater pain reduction than placebo, and the higher dose was more effective than the lower dose. In fact, those in the 600 milligram group experienced more than a 50% reduction in pain scores. In 118 patients with nerve pain, 30 days of standard treatment plus 600 milligrams of PEA daily was more effective than the standard treatment alone. A randomized clinical trial found 900 milligrams of PEA daily for 1 week, followed by 600 milligrams daily for 1 week, was more effective than ibuprofen at a dose of 600 milligrams 3 times a day for 2 weeks for relieving TMJ pain. Micronized preparations of PEA have also been studied. The micronization results in smaller particles, and these can be absorbed more readily. The micronized PEA at doses of 600 to 1200 milligrams per day reduce pain in subjects with diabetes or trauma-related nerve pain, chronic pain after failed back surgery, and acute pain from a tooth extraction. In a report of 100 cases of nerve pain related to spinal disorders, the inclusion of an ultra-micronized PEA supplement in pain management therapy showed promising results. A meta-analysis found that women with chronic pelvic pain due to endometriosis appear to benefit from the combination of 800 mg of PEA plus 80 mg per day of polydatin a natural free radical reducing agent found in grapes and red wine. In a randomized control trial, the combination of PEA and paldatin was more effective than a placebo for reducing abdominal pain in irritable bowel syndrome patients. Fatty acids are essential nutrients derived from the dietary intake of fat. They're an important source of energy for the body, and they serve a variety of other biological functions. A greater dietary intake of omega-3 polyunsaturated fatty acids has been linked to a reduction in both inflammatory and neuropathic pain, and it's been shown to be beneficial for decreasing pain that's associated with rheumatoid arthritis, dysmenorrhea, inflammatory bowel disease, and neuropathy. Conversely, excessive levels of omega-6 polyunsaturated fatty acids, like arachidonic acid, are associated with inflammatory activities, an effect that can be offset by the simultaneous consumption of omega-3 polyunsaturated fatty acids. In response to an arachidonic acid overload, the body increases its production of enzymes like 5-lipooctagenase, or 5-LOX, to degrade the arachidonic acid. Not only do 5-LOX products directly stimulate cancer cell propagation, but the breakdown products that the 5-LOX produces from arachidonic acid cause tissue destruction, chronic inflammation, and increased resistance of tumor cells to apoptosis. Some people take arachidonic acid to increase the inflammation to help to increase muscle gains. However, this is controversial and may be dangerous. It's important to understand that 5-LOX is not the only dangerous enzyme the body produces to break down arachidonic acid. COX-1 causes the production of thromboxane A2, and this can promote abnormal arterial blood clotting or thrombosis, resulting in a heart attack and stroke. COX-2 is directly involved in cancer cell propagation, while its breakdown product, prostaglandin E2, promotes chronic inflammation. Most health-conscious people already inhibit the COX-1 and the COX-2 enzymes by taking low-dose aspirin, curcumin, green tea, and various flavonoids such as resveratrol. A more integrative approach to this problem, however, would be to reduce the levels of arachidonic acid, which is the precursor. Experts believe another mechanism responsible for the anti-inflammatory effect of omega-3 polyunsaturated fatty acids has something to do with their metabolites, which possess potent anti-inflammatory properties. Resolvins bind and they activate receptors on immune cells and neural cells, leading to alterations in pain transduction in the spinal cord and a dampened inflammatory response. The positive effect of omega-3 on the neuropathic pain has been partially explained by their ability to block voltage-gated sodium channels, ultimately interfering with pain signaling. Because omega-3 polyunsaturated fatty acids are associated with positive effects on cognition, mood, and behavior, they may also be beneficial to central pain processing. Omega-3 supplementation can also help to reduce anti-inflammatory analgesic consumption, which in turn might reduce the associated risk of developing gastrointestinal side effects. Since omega-3s don't interact with most analgesic drugs, some experts recommend their concomitant use. Gamma-linoleic acid is a plant-derived omega-6, and it's most abundant in the seeds of borage. It's also found in evening primrose oil. Although it's a member of the omega-6 family, it's metabolized differently than other omega-6s. Gamma-linoleic acid plays an important role in modulating inflammation throughout the body, especially when it's incorporated into the membranes of immune cells. A team of Taiwanese researchers discovered that gamma-linoleic acid regulates the inflammatory master molecule, nuclear factor kappa B, preventing it from switching on genes for inflammatory cytokines in the cell nuclei. A separate mechanism by which the gamma-linoleic acid and other beneficial fatty acids reduce inflammation is by activating the powerful peroxisome proliferator activated receptor, or the PPAR. This is an intracellular receptor, and it modulates cell metabolism and response to inflammation. The class of anti-diabetic drugs, like thiazolamides, also act by targeting the PPAR receptor, but unlike GLA, these can be deadly. In studies, gamma-linoleic acid has been shown to relieve pain that results from a variety of conditions, including neuropathy, breast pain, and rheumatoid arthritis. Vitamins B1, B6, and B12 are not only beneficial for managing pain that can result from a vitamin B deficiency, but they're also effective alone or in combination with other conventional medications for various painful diseases like degenerative spine disease, rheumatic disease, lower back pain, and tonsillectomy pain. The administration of a mixture of B1, B6, and B12 has also been shown to reduce neuropathic pain in humans and animals, and it can therefore help treat peripheral neuropathies. Benfotiamine, a better absorbed derivative of B1, has also been suggested for reducing inflammatory and neuropathic pain in humans. Evidence suggests that neuropathic pain plays a considerable role in many cases of chronic pain, and that B vitamins primarily provide relief by targeting pathways that are associated with central neural pain processing. Vitamin C is a versatile antioxidant, and it can act as another natural shield against pain. Accumulating evidence indicates that free radicals play a role in the exaggeration of pain hypersensitivity. Vitamin C has been linked to a rapid and consistent anti-nociceptive pain-relieving effect in animal studies. A 2011 animal study revealed that the administration of the antioxidants vitamin C and E inhibited pain related to peripheral injury. The authors concluded supplementation or treatment with both vitamins might be an option in patients who are suffering from specific pain states. Administration of vitamin C also reduces spontaneous pain that's associated with post-therapeutic neuralgia, which is a type of peripheral neuropathic pain. Prophylactic vitamin C supplementation has also been linked to a 5-fold decrease in the incidence of complex regional pain syndrome among patients who recently underwent foot or ankle surgery. Vitamin D, once converted into calcitriol, inhibits inflammation by regulating some of the genes that are responsible for producing pro-inflammatory mediators like cytokines. In addition to being associated with pain due to bone softening, like osteomalacia, a vitamin D deficiency has also been linked to fibromyalgia, chronic widespread pain, and unusual pain syndrome characterized by musculoskeletal and bone pain. In addition, the administration of vitamin D was found to significantly reduce pain for women with chronically painful periods in a randomized, double-blind, placebo-controlled study. You should always be tested for a vitamin D deficiency and then supplement accordingly with vitamin D3. Vitamin E has been associated with a reduction in the severity of cyclic breast pain, a condition affecting as much as 69% of women. It's also effective at relieving the pain associated with menstrual cramps. In experimental models, supplementation with tocotrienols, a certain type of vitamin E, has been shown to improve neuropathic pain intensity associated with both diabetic and alcoholic neuropathy in animal models. The analgesic effect of vitamin E might be partially explained through its antioxidant properties, which involve blocking the production of reactive oxygen species that are involved in neuropathic pain. Vitamin E's analgesic effect might also be related to its ability to make the brain less sensitive to pain. Curcumin is a major component of turmeric, a spice that gives Indian curry its distinct color and taste. In addition to its culinary use, curcumin has long been part of traditional medicine, and it's been appreciated for its anti-inflammatory properties. Specifically, curcumin has shown to reduce the levels of the inflammatory mediators TNF-alpha, interleukin-1 beta, and interleukin-6, which contribute to nociceptive hypersensitivity. Since the curcumin has been shown to have analgesic effects in numerous clinical trials, it might be useful for a variety of pain conditions. For example, a systematic review of clinical trials has found curcumin can improve pain in osteoarthritis and rheumatoid arthritis. Curcumin is also used in India for managing traumatic and post-operative pain, and it's been shown to reduce chronic neuropathic pain in animal models. One potential challenge with curcumin is its limited oral bioavailability. Upon ingestion, curcumin is rapidly metabolized into various related molecules, which might not provide the same benefits as free curcumin. Researchers have explored different ways to improve the bioavailability of curcumin, including combining with galactomannins, a fiber from fenugreek. In one double-blind crossover study with 50 participants, this novel curcumin preparation had a 45 times higher bioavailability of free curcuminoids than an unformulated curcumin. Boswellia Serrata is a plant native to India and has been used for centuries in Ayurvedic medicine. The plant's resin contains numerous terpenes and 4 major pentacyclic triterpenic acids known as boswellic acid. These boswellic acids have anti-inflammatory activity, including the inhibition of 5-LOX, interleukin-1 beta and TNF-alpha. Boswellia extracts have been shown in systematic reviews of clinical trials to improve pain in osteoarthritis. A small placebo-controlled crossover study demonstrated a single dose of Boswellia Serrata, 250 mg, increased pain tolerance in healthy adults. In a report of 4 patients with chronic cluster headaches, Boswellia extract was associated with reduced frequency and intensity of headaches. Sesame is a flowering plant and is grown in tropical regions worldwide. Its seeds and oils are often used in food, and these also possess anti-nociceptive and anti-inflammatory activities. Sesame oil was shown to reverse the overexpression of interleukin-1 beta and TNF-alpha in an animal model of neuroinflammation. In a trial of 50 patients with osteoarthritis of the knee, sesame supplementation significantly reduced pain intensity compared to placebo. In a study with 88 subjects with acute musculoskeletal pain, treatment with a proprietary mix of curcumin, boswellia, and black sesame oil resulted in pain relief comparable to acetaminophen. Interestingly, while both groups experienced similar reduction in sensory pain, the herbal preparation group was greater than 8 times more effective than the acetaminophen at relieving the emotional aspects of dealing with the acute pain. Ginger has analgesic and anti-inflammatory properties that soothe progressive muscle pain. Certain wild ginger species have anti-nociceptive characteristics, and they've been used traditionally to treat toothache, muscle sprains, and swollen cuts and sores. Researchers have also found that regular consumption of ginger is an effective pain reliever for arthritis patients, as well as muscle injury due to exercise. For the treatment of menstrual pain, ginger has been found to be as effective as conventional analgesics like ibuprofen. Long-term administration of ginger reduced TNF-alpha expression and augmented levels of anti-inflammatory hormone corticosterone in rats, suggesting it relieves pain by suppressing inflammation. Pro-Anti-Cyanides, tannins belonging to a group of chemical compounds called flavonoids, which provide a variety of beneficial functions for humans. Example, their well-known antioxidant and anti-inflammatory effect. Like grapeseed, are especially a rich source of pro-anthocyanidins, and these have been associated with symptom reduction in a variety of painful diseases, like diabetic neuropathy and chronic pancreatitis. Other sources of pro-anthocyanidins include berries, seeds, flowers, and leaves. The mechanism by which the pro-anthocyanidins alleviate the pain is not well understood, but some evidence indicates that central interaction with dopamine receptors might be involved. Melatonin is a naturally occurring hormone, and it's synthesized by the pineal gland, and it's regulated by the environment, the light and dark cycle. Melatonin can reduce pain through its beneficial effects on sleep, as well as its analgesic properties. It's also a potent antioxidant and has been shown to reduce the pain associated with a variety of chronically painful conditions like fibromyalgia, IBS, and migraine. A study in infants found that melatonin powerfully relieves pain by suppressing levels of interleukin-6 and other inflammatory cytokines. Melatonin is such a remarkable compound that its chemical structure may be the basis of new analgesic drugs for the treatment of pain associated with cancer, headache, and even surgical procedures. Methyl sulfonyl methane, or MSM, is an organic sulfur-containing compound. It is found in a variety of fruits, vegetables, grains, and meats. Among its many beneficial functions, MSM has been shown to display anti-inflammatory and antioxidant properties. MSM has been successfully used to treat pain associated with osteoarthritis, and it's not typically associated with any significant adverse side effects. When combined with Boswellia, the MSM significantly reduced the need for non-steroidal anti-inflammatory drugs compared to a placebo among subjects with knee osteoarthritis, suggesting the combination exerted considerable anti-inflammatory action. Docurcinol is a medical compound found in the roots of a Korean flower called Angelica gigas nekia. It's been widely used in traditional Oriental medicine as a treatment for pain associated with menstruation, arthritis, migraine, abdominal pain, and other miscellaneous injuries. Researchers suggest the docurcinol might act in the central nervous system and exert its analgesic effect or interfere with nociception. Scientists report lab evidence showing that an active constituent derived from Korean Angelica inhibits the activation of nuclear factor kappa B, a DNA transcription factor that's involved in many inflammatory and disease states. More recent studies indicate the co-administration of docurcinol and acetaminophen resulted in synergistic effects. This enabled the acetaminophen to be therapeutic at a lower than normal dose. This acetaminophen sparing effect implies that docurcinol might inhibit the COX cyclooxygenase enzyme. Capsaicin, a compound that gives chili peppers their spicy taste, also has medicinal value as an over-the-counter topical pain reliever. It's well tolerated and it comes in a variety of formulations, such as creams, gels, lotions, patches, and sticks. It's been shown to be an effective analgesic for lower back pain, as well as chronic pain originating in the muscles, the tendons, and the ligaments. Topical capsaicin has also been associated with a significant reduction in neuropathic pain. Researchers believe its analgesic effects occur as a result of its ability to reduce the amount of nerve fibers in the application area upon the long-term administration, as well as its capacity for interfering with nociception. Both of these actions ultimately contribute to a local decrease in responsiveness to a wide range of sensory stimuli. While L-phenylalanine is a naturally occurring amino acid that's a precursor to dopamine and related neurotransmitters, D-phenylalanine appears to slow metabolic breakdown of endogenous opioids. DL-phenylalanine, which is a mixture of both stereoisomers, might therefore provide an analgesic and mood-boosting effect. Some limited evidence suggests supplementation with phenylalanine might provide pain relief, but larger, well-designed studies have failed to corroborate these early observations. Evidence is currently insufficient to draw firm conclusions as to the pain-relieving efficacy of the DL-phenylalanine. Antidepressant medications provide analgesia via various mechanisms, including by boosting the levels of serotonin, which helps the brain to control pain sensations. Therefore, since the amino acid L-tryptophan and bioactive compounds in saffron can modulate serotonergic activity within the brain, some innovative scientists have proposed them as potential central pain relievers. For people who are taking high doses of acetaminophen for pain relief, supplementation with liver protective nutrients might be beneficial, like N-acetyl L-cysteine, S-acetyl glutathione, selenium, and milk thistle extract. For more information about herbs, supplements, and natural treatment plans, check out my website.